of the connection between education and disability in Uganda by profiling the range of disabilities among children and assessing the extent to which assessment systems facilitate inclusive, equitable, and accessible learning opportunities. But for this particular one specifically, we intend to identify and analyze the different types of disabilities among school-age children in Uganda and their implications for access, participation, and learning in education. The second one is to evaluate the role, accessibility, and effectiveness of disability assessment systems in identifying children's educational needs and supporting their inclusion within the education system. I know we also aim to promote dialogue among practitioners, policymakers, and stakeholders on how to improve inclusive education outcomes in Uganda. Inclusive education, like the ED has said, has made a few steps, and saying we have arrived would be a lie. That's why we must, all of us in our spaces, get involved in this to see that we arrive. Ladies and gentlemen, allow me make mention that we are now live on YouTube. It's not too late for you to tag a friend, to tell a friend, not necessarily NGO people, but as parents. This is a very pertinent issue as parents that are still in the process of nurturing children, as community people that have opportunities on pulpits, on church pulpits, on village committee pulpits. This is very, very crucial for everyone. It's not only for people that are in NGO or government spaces. So it is now my pleasure, ladies and gentlemen, to introduce our first presenter. And our first presenter, who is meant to be Mr. Gerard Koraneza, Mr. Gerard Koraneza, unfortunately lost his uncle. I will ask us to take a moment of silence so that we honor him. May his soul rest in eternal peace. Mr. Koraneza, an associate director at Ubuntu Disability Action for Development, brings an extensive experience in disability inclusion, policy, and community development. His preparation, which we are going to present to us, will be able to take us through an overview of disabilities among school-age children in Uganda and the implications for education. Allow me invite Mr. John to take us through Mr. Gerard Koraneza's presentation. Mr. John Chivumbi, you are welcome. Mr. John Chivumbi.
Good morning, everyone. Can you all hear me?
Yes.
Yes, we can.
Okay,
Yes, we
so
can.
this is the presentation that I shared with me. So allow me to take you through the overview of disabilities among school-age children in Uganda and the implications that it has on education. So this is our presentation outline that we are going to use throughout the presentation. We are going to first have an introduction and definitions, then the prevalence of disability among children in Uganda. I'll delve into the types of disabilities, then the key barriers to education, the implications for the education system, then we shall look at a few recommendations, then the conclusion. So we need to first understand what disability is, because this is one of the terms that interface quite a lot as child rights actors. So a disability is a condition that affects a person's ability to perform certain activities or interact with the world in the same way as others. We see that it can be put in two different aspects. It can be physical, affecting movement, body function, where a person might have difficulty in walking or paralysis. Then it can be categorized under sensory, affecting the senses like vision or hearing, which leads to blindness and deafness. Then it can be intellectual or developmental, where it affects the learning or understanding of a person. This is where we have conditions like autism and Down syndrome. Then we also have the mental and psychological, that affects the emotions and the thinking or the behavior of a person. So all this is categorized as disability. Then the prevalence, this was done by a study done by Uganda Bureau of Statistics in 2024, where they got to know that 13.2% of Ugandans, those that are 2 years and above, have a disability. So you can see that the percentage is quite alarming. Then 8.8% of this population are children at the age of 2 to 17 years. They live with disabilities. So this was a study conducted by UBOS 2024. I'm sure these statistics changed in the previous year because they conducted another study. Then the types of disabilities among children, there are quite many, but the common functional difficulties include seeing, where a child is having a visual impairment, can be hearing, which leads to deafness, then mobility, where the walking is difficult for the child. Then we have the cognitive, where the child can't remember or concentrate. Then communication, where a child can communicate well with the peers or the other children. Then the self-care limitations. Then the other conditions that we see, cerebral palsy, we have autism, we have epilepsy, and Down syndrome. Then the distribution and inequalities, we see that there was a study conducted by UNICEF, and it was known that higher prevalence in the rural areas. So we find that most children in rural areas are prone to disability. Then this study went on to show that regional disparities are higher in northern Uganda historically. So in northern Uganda, the study showed that there are quite a number of children that are living with disability. Then we also saw gender differences. This was still a study under UBOS. There's slightly higher among females overall. So we find that the girl child is more affected when it comes to children living with disabilities. But then we go on to see that many cases are underreported due to stigma, fulfillment, and this was a study done by an organization called Better Care Network 2022. So we find that some children are hidden away, they are not given the care, the extra care they need as children living with disabilities. Then we look at the education access for children with disabilities. Find the study done by UBOS shows that 51.3% of children with disabilities are out of school. And this is between the age of 6 to 24. That means many children drop out of school because of disability. Then the study conducted by ISA Uganda, one of our members in 2022, shows that 9% of the children with disability attend primary school and 6% transition on to go to secondary school. Then a study done by UN in 2022 shows that enrollment and completion rates remain significantly lower than the years. You notice that some of these studies are way back in years. That also shows a gap in the studies that are done. We find that in some cases are not reported, find that some of these studies are way back in years, but these are some of the latest statistics that we are able to gather. Then what are the key barriers to education when it comes to children with disabilities? We see that they experience physical barriers where most of them can't access some of the school infrastructure. Then we have institutional barriers where we have limited trained special needs teachers and inadequate learning materials for the children with disabilities. Then we also have social barriers where we see that there's a lot of stigma and discrimination and cultural beliefs among the communities. Then we also have economic barriers where we see that poverty and inability to afford assistive devices, because some of the devices are quite expensive. We find that of the families can't afford to buy them for the children. Then we also have systematic barriers where we have weak data systems and planning. Because like I mentioned earlier, the studies are quite not as many as we would expect. That's why we lack some information when it comes to children living with disability. Then the learning environment. The learning environment, see that there are quite a number of challenges, but these are the main ones that I wanted to share with you. We see that there are overcrowded classrooms, and this really hinders the children with disabilities since, as I shared, under the different forms of disability, we have the one of physical disability, where some children have difficulty movements. So you find that the classrooms are overcrowded, and this really hinders their time at school. Then lack of assistive technologies, either brailles, the hearing aids, some are quite expensive, and most children miss out school because they can't really afford buy these assistive technologies. Then limited individualized support, where we see that the special teachers that are really supposed to help the children are very few. And when you find the few that are available, the rate is really high. The rate, you find that particular teacher has to handle quite many. So there's that gap that brings the challenge. Then inadequate inclusive practices, where you find that some schools don't have these assisting practices, where you find some schools don't have ramps, and you find that the children really struggle to access some of the areas in the school. Then inability to assess disability. Still, it goes back to the special persons that really handle the children with disabilities. We find that some teachers are not trained on how to identify the different forms of disabilities. We find that the child is left out because of that inability to know that he or she has a disability. And the implications for the education system is that due to the different disabilities, there's increased inequality in education outcomes, since some of the children are left out. Then exclusion from mainstream schooling, like I mentioned earlier, some of the children drop out and don't continue to higher education because they can't afford some of the assistive systems. Then lower literacy rates among persons with disabilities, and still a study conducted by UBOS in 2024 shows that there was a 60.8% literacy rate. Then reduced transition to higher education. Some children stop in primary level, some stop at secondary level. So you find that they don't go on to continue with higher education. Then we have some of the long-term effects. That's unemployment and the poverty cycle. Then the recommendations that I want to share with the government, partners, that there's need to strengthen inclusive education systems, and we adopt a curriculum methods that are really conducive for all children, be it children with disabilities or the able children. Then there's need to invest in teacher training, because like I mentioned earlier, the special teachers, the special needs teachers are really few. And the few that are available, you find that the ratio is really overwhelming for them. Then we need to improve the infrastructure, where the children can access the schools and the facilities so that they are not left out because they can't access some of the facilities in the school. Then we need to enhance data systems where we have better identification and tracking of the children living with disability. Then we need to increase funding. Most of our work as CSOs, as partners, we need to target disability inclusive programming where all children are treated equally and not leaving any child behind. Then we need a multi-sectoral approach where we link education, health, and social protection so that all the sectors are at work to see that the children are really supported. So in conclusion, disability among the school-age children in Uganda is significant and under-addressed. The education systems are still facing a lot of systematic inclusion challenges, and there's need for inclusive policies in practice. There's need for equitable resource allocation, and also there's need to ensure that inclusion is key to achieving SDG 4 and child rights. As we all know, SDG 4 is on inclusive education in all countries world. So these are the key references that we used in our presentation. The WUBOS 2024 National Population and Housing Census Disability Monograph. Then the UNICEF Situation Analysis of Children with Disabilities in Uganda that was conducted in 2021. Then ISA carried out a study on the status of SDG 4 in Uganda. Then Better Care Network also conducted a study on hidden reality of children with disabilities. Thank you very much for listening.
Quite impressive. Thank you very much, Mr. John Chivumbi. Yes, thank you for those numerous claps, hands that are coming in. Thank you. You may continue doing that. Your presentation was surely clear as you highlighted the realities and implications of disability among school-age children in Uganda. I want to remember when you mentioned poverty and also the gaps, the knowledge gaps within teachers. You reminded me of a time where Jacqueline Hoffenbauer is a teacher as well, where I was contacted by a few of my teacher friends. At the time, I had left classroom teaching and I was into community teaching that I'm doing currently. So some of my friends consulted me and said, Jacqueline, we have a parent that was looking for your services. We want to take them on, but we want to use you as a person that is going to be offering the support for this child with learning disabilities, because at the time, that's what I was handling. And then I realized I was too busy. I cannot support that parent while I'm doing this other work. But what motivated the other people on the other side was the money that the offer seemed to come with. So parents, practitioners, community people, let us be aware of people that are ready to take your money at any cost, at whichever cost. Take your money in the guise of supporting your child, supporting that student, that child in the community that has that learning disability. They know that parents are desperate and they want to squeeze every little money, every little coin for things they are not sure of, for diagnoses that they don't know about. For starters, they didn't know what exactly the child was suffering. But because the parent was highly placed and had that someone that can support their child, so they wanted to manipulate that person. Let us be careful where we take our children. Let us be careful who we consult in regard to supporting children with learning disabilities. Once again, thank you, Mr. Chivumbi, John, and it is my pleasure now to introduce Mr. Eid Mubaraka Musimani. Mr. Musimani is an inclusive education officer at KCCA. He has a vast experience in special needs education, given his academic background, his very rich academic background. He also is very good at inclusive systems. Mr. Musimani, over to you.
Thank you, Jacqueline. Once again, my name is Idi Mubarak. I'm in charge of inclusive education. Yes, I'm going to talk about the role of assessment or disability assessment in inclusive education. First of all, assessment is the process of identifying, evaluating, examining the condition of the learner that may affect his normal learning and development. Assessment is basically done by different people because we have different stakeholders that do assessment. We have education assessment that we do as educationists, especially those of us who have done special needs. We have psychologists who also do assessment, especially issues to do with intellectual impairment and developmental disorders. Then there is some medical assessment that is normally done, especially to issues to do with issues with the sensory impairments and physical disabilities. For example, hearing loss is done in the hospital. Visual impairment is also done in the hospital by the doctors. Then physical disabilities are done by the physiotherapists. Now in Uganda, we had 54 assessment centers, 46 assessment centers during the time of Danida. Danida used to support, to finance the Ministry of Education, and their focus was on inclusive education, special needs education. By then we had 56 districts, and therefore they constructed assessment centers in those districts. Of course, Kampala is one of the districts that benefited, and many other districts. And they placed 3 staff, one in charge of intellectual impairment, they used to call it mental retardation, one responsible for hearing impairment, and one responsible for visual impairment. And these were teachers trained in special needs. So they used to conduct educational assessments in the districts. But when the Danida project ended after 10 years, this role was taken back to the local governments. So the districts had to come in, and the districts were required to facilitate and support all activities regarding special needs education. Out of the 46 assessment centers that the ministry constructed in the 46 districts, today, as I talk now, we have only one functional assessment center, and that is the KCCA Inclusive Education Assessment Center, which I do coordinate. We assess learners both in school and out of school. We depend on identification and referrals of the people that are near or that have access to these children. For instance, schools identify learners with special needs. Then they contact me. I normally give them appointment, and they come or they bring the children. Sometimes the children are brought by the parents. Sometimes the children are brought by the teachers. I usually prefer that they are brought by the parents because parents will provide the background information which the teacher doesn't have. However, the teacher will always tell you the challenges that the child faces in learning in school. And then in the community, some community members have identified their children or the children in the neighborhoods that have different special needs. So sometimes they call you, Eden Barak, I have a child here with a problem ABCD. So what I do, sometimes I tell them to bring the children for assessment, and other times I refer them to the hospitals. If, for example, the issue is a medical issue, so we refer them to the hospitals for assessment. I want to give an example of last year alone. Last year, we assessed over 400 learners with special needs. But now that teachers have also learned to identify, they do identify, but to them, they put more emphasis to the candidates, learners in the candidate classes, especially primary 7. So when they identify them, they declare them as candidates with special needs on the UNEB portal. Now, those that are brought to us, we assess and provide assessment reports. Some go to the hospitals and they get medical reports. And then you have to attach this report on the UNEB portal as you register them. Then UNEB sends another person to come and verify and confirm, is it really true that this person X, this candidate has a special need? Is it true that the support the school is requesting for is actually the required support? Now, last year, we in the whole country we had 3,911 candidates that sat for candidates with special needs that sat for PLA in 2025. Out of that number, Kampala alone, because of the work that we've done, we had 722 candidates who sat for PLA. We think this contribution has done a great job, and that is possibly 20% of the total number of candidates who sat for PLA. So it is that important. Also, it is important that we assess these children because of the required interventions. Receiving accommodations, we call it reasonable accommodation, at PLA is one of them. But also in school, in order to promote inclusive education, we need to carry out assessment. Such that, because this assessment guides you on what interventions should be done, what exactly that Eid Mubarak requires. If his challenge, for example, is low vision, what should we do to ensure that he is able to access the print? Is it really low vision? If yes, what kind of print should we provide? Because we recommend large print, but not every large print is suitable for Eid Mubarak. So it should be targeted intervention. Whereas other people are able to read font 12, which is the normal standard for examinations and most of the print documents. Maybe Eden Baraka requires font 18. Maybe it will benefit from font 24. Then placement in the classroom. You'll find some children are able to benefit from sitting in front, or the other one may benefit from sitting a little behind. The problem with some of the teachers, especially those who are not trained, is the thinking that all short children, all short learners should sit in front because they are short. Yes, I could be short, but then I have a low vision, and my low vision requires me to sit behind. I'm long-sighted. So I'm short, but I would benefit from seeing on the chalkboard when I sit behind. So we guide based on our assessments. Then the instructional materials being used in class. What kind of materials are suitable for this learner? Then the language that we use to communicate. Are we really communicating, or we are just talking to people and people are not benefiting? You may have a learner with hearing impairment in your class. The learner is not actually hearing. For you come and speak your very good English, and you think you are talking to everybody. There is that other child you're leaving behind because he's not understanding. Today we have refugees who have issues with the language barrier. And the system today in most of our schools, for example, when you go to thematic curriculum, we say, let us use the local language, the language that most people understand. Yes, we are using the local language, possibly Uganda, in central here. But are we catering for everyone's needs? If not, can you identify that this Eden Barak does not benefit from this local language, such that you are able to, after explaining to the rest of the learners, then you get to Eden Barak one-on-one and explain to him in a language that he understands. If one requires sign language, please use the sign language. If it means using gestures and maybe alternative communication skills, then you use those ones. Sometimes we even use pictures. A child will simply point at something and then you understand he wants to do ABCD. If a child, for example, points at a cup, you will know either wants tea or water. Okay? So it is that important. Some of the challenges are, one, our teachers and even parents, sometimes they delay to identify that this child has a problem. And actually, we're not looking at a special need per se, we are not looking at a disability, but identifying, understanding that this child is behaving in a way that is not expected of him as of his age. Maybe there is a problem. Maybe something's not right. So when you identify that Eden Barak is doing things that is not expected to be doing as of his age now, just know there is a problem. So we start from there, and that is identification. You are detecting the issue. So we start from there. Maybe he needs some support here and there. So if after we have identified, then we look for support. What do we do? Look for somebody who can support. Look for assessment now. You either come to us for assessment, you go to the hospital for assessment. Then after that, we shall place this child. You find somebody is insisting my child should go to an inclusive school, yet this person is not going to benefit in the inclusive school. He may benefit better in an exclusive school, that is a special school. And the other teachers say, or head teachers say, no, we cannot accept this child in our school. For us, we are not trained. For us, this school is not for those children. Take this child to a special school. Yet this child would benefit best in an inclusive setting, because not everybody should be placed in a special school. So that is also one of the roles. So we guide and say, let Eid Mubarak benefit from an inclusive setting. It is the role of the school now to adjust. Because if Eid Mubarak, say for example, if I have blindness, I'm totally blind, and then you are telling me, for you, you don't have a school for, your school is not for the blind, you don't have facilities for the blind, therefore, are you telling me to change my status from being blind to getting sighted? It is not possible, because some of these issues are natural, they are biological, they are God-made. I never applied to have a disability or a special need. So it is the role of the school to adjust, to fit in the needs of the learners. We have some challenges in this assessment. You assess one, late assessment. When they identify the child late, you definitely conduct the assessment late. When this child is assessed late, then we find another issue. One, for example, most of the teachers look at that candidate class because they want this person to benefit from the support, the examination support that UNEB offers. But when they bring the children, you assess, you make appropriate recommendations. The school should do A, B, C, D. The parent should do A, B, C, D. Some of the challenges we have seen is that some schools do not share our reports with the parents. So parents do not know what to do because they were not informed. What they think, what they understand is simply to place or to take this report to UNEP. And they don't even implement their own recommendations. Because, for example, a child with a disability maybe has a cerebral palsy, is unable to write, so he needs a transcriber. We are saying, let the schools start transcribing for this candidate, right from the word go, within their own learning experiences. As you teach today, you transcribe for this learner. Because after teaching, you evaluate them, you give them some exercise. Can you ask this learner questions orally, and you write the answer that they give you? And transcribing will mean you read the question to this learner. For example, what is the capital city of Uganda? And the learner will give you the answer. Say Ginger. Write the answer as Ginger. Hello? Hello? So that is transcription. Exactly. You write exactly what the learner has told you. Because for the transcriber, you act as the hands for this learner, not the brain. The brain belongs to the candidate. Don't write what you think is right. Write what the learner has told you. So that's what we normally do. So we want the schools to implement the recommendations we have given them in the assessment report, and then they share these reports with the parents so that the parents are also able to implement their recommendations. If those two recommendations are implemented, the child will always get supported. I was told of a student in one of the schools who rejected a transcriber. She went to the teacher and to the head teacher and said, no, Madam Head Teacher, this guy is cheating for me. And the head teacher was like, why? Why do you think he's teaching for you? He's writing answers for me. Then they asked him, is he reading the questions to you? Yes. Are you giving him the answers? Yes. So he's writing your answers. Is it true? Yes. But why? I think I can write for myself. And now they explain to him, yes, you can write for yourself. But now the challenge is, number one, your writing is not clear. So the examiner will not be able to read. Number two, you are too slow. You will not complete. So could you please allow him to write for you? You give him the answers, he writes for you. If you want to read through, please ask him for those, for what he has written, you read through. So after that counseling, the boy accepted. So those are some of the roles of assessment in promoting inclusive education. Thank you for now.
Thank you so much, Mr. Eid Mubaraka Musimani, Mr. Musimani. An amazing name, and for such an elaborate submission. Very informative presentation. Ladies and gentlemen, time check. It's midday. We have 1 hour left, 1 hour to go. And we will now transition into our panel discussion, focusing on bridging assessment and inclusive education in Uganda. On our panel tonight, I'm delighted to introduce to us an amazing woman of God, Ms. Namboze Rosemary Mchalani Wagaba Omubwati. She is a woman activist and disability inclusion expert with over 15 years of experience in NGO development world. Ms. Rosemary comes with a vast experience working with families and children with special needs. Ms. Rosemary, once again, has a very vast academic experience. She is a mother of 4 children, and she is the co-founder and director of Angels Center for Children and Special Needs. Ladies and gentlemen, put our hands together as we welcome Ms. Namboze Rosemary Niwagala. The panel will have both Rosemary and Mr. Eid Mubarak. So join me once again to invite Mr. Eid Mubarak also to join us once again to do this panel. We shall go straight. Let us start off this. I'd like to pose this question to Mr. Mubarak. It's you that has just dropped the microphone, but also allow me ask this. From your vast experience with KCCA, highlight for us the most critical gaps in early identification and assessment of children with disabilities in public schools. Thank you.
Thank you so much once again. The most critical gaps in identification of learners, like I earlier said, are late identification of disabilities. Like I said, most of our learners are not identified early. There are few that they will tell you this child has a special need, and yet when this child is in possibly preschool and lower primary, they are very few, unless it is an obvious disability, the ones that we see, the visible ones. But for issues of learning disabilities, it is not very easy to identify at that lower level. Nursery P1, P2, they don't normally identify them. For example, a disability like dyslexia. Dyslexia is a dyslexia is a challenge in reading, writing, and spellings. A child will look just very okay, will appear very okay in most cases. And in most cases, their IQ is very good. They don't have any problem with mental challenges. When you ask him the question, he will do it, he will give you the very correct answers. And even performance and these other activities, they are always very good. But when it comes to issues of reading, writing, and spellings, that's where they normally find challenges. You will find somebody, for example, somebody with a severe dyslexia issues may even fail to write his own name, even to write the simplest word, cow or dog, three-lettered words, they may even fail. And in most cases, in order to identify this, sometimes one, they write some letters in a reversed manner, like a D for B. So instead of writing boy, he writes a doy. Can write G for 9. Can write M for W, N for U, that kind of thing. So, but that one is most cases identified at the level of primary 4 onwards. Because, for example, in nursery, that could be expected. Maybe she's just the child is just learning. So late identification is one issue. But also low self-esteem, especially to us the parents. When a parent gets a child with a disability, sometimes we deny. Sometimes we don't want to talk about it. But is it really my Mariam? But of all people, this one, such a beautiful girl. You understand? So you're failing to accept. And therefore, because you have failed to accept, you have failed, you cannot find support because you've not accepted. No, she's going to do better. I think she's going to improve. Then the other challenge is the negative attitudes from our schools. Some of our schools, and I'm saying our schools to refer to all the schools in this country, not necessarily in Kampala. Some of the school heads, when you take a child with a disability and you tell them, I have brought Eden Barak, but he has challenges, he doesn't hear properly, or he's unable to walk around, so he's in a wheelchair. Some of the schools do not allow to admit these children. They rejected them. I believe and I hope that now they have got to understand that it is illegal to deny admission to any learner because of a disability. But they used to deny them. Then lack of early assessment systems. Sometimes a child or a school will understand, yeah, this child has issues, but you don't have systems to scrutinize or to screen them to detect that really this one has a special need or a disability. That should be done with the effect or with the coming into force of the Washington group questions, which have been adapted by UNICEF. And this adoption has brought into force what we call CFM teacher version, that is child functioning module teacher version. Now we have started training our teachers countrywide on that screening tool. It is a screening tool. It is an identification tool. It is a tool of questions, a set of questions, where they will ask you, does Edinburgh have any difficulties seeing? If yes, does he use glasses? If yes, does he still have difficulties seeing even when he's using glasses? So that tool will help us to identify these children early enough. Now, after we have identified them early enough, we refer these children for a formal assessment, either in the hospital or to us in the assessment center. Like I said, there are those special needs that have to be assessed in the hospital, and then a clear diagnosis is given by the medical personnel. Whereas the learning disabilities are assessed by us, because we even receive referrals from the hospitals to us to assess learners with learning disabilities, because these ones are now educational issues, and then we give clear recommendations. The other challenge is that we have fewer teachers who are trained in special needs education. There are not many who are trained. The reason is because, one, some of the teachers don't want to bother themselves with so many challenges that are faced by learners with special needs. So they want the easier part. But two, they see no difference between a teacher who is teaching these children with difficulties. By the way, there is a lot of science that we do apply in special needs. I have a colleague, he's a division medical officer in one of the divisions, but he keeps saying, Edinburgh, your course special needs and medicine are sister fields, because there are so many other issues that we handle. Even the studies that we do, a lot of neurology is purely biology. Just imagine the way you can enable this child who doesn't see to see exactly what you are teaching the rest of the learners, including the BAP. The way you can ensure that this person who does it here is able to understand the content that you teach even the other learners who can hear. It isn't easy. And even the way we do to model the behaviors of learners with intellectual impairment and so many others. We have received parents who say, no, now this child, kind of take him away, take him to a special school somewhere. For me, I want to do other things. He has kept me home. I cannot do anything. This child is so hyperactive. He's like this. So you need to do ABCD. So there is a lot of science that we do apply. And their thinking, the teachers, was that maybe at one point in time, government would think of a separate form of remuneration, but that has not come out. Possibly, maybe we are waiting, because there is a policy that is in cabinet. We hope if it comes out and these teachers are remunerated well or better, possibly it will encourage the other teachers also to join us in the field. So I was talking about the screening systems. We are going to use the child functioning module, teacher version, to start screening our learners as of when the child enters school. We need this child to be screened, and then we are able to, we can receive this information, and then we do the assessment early enough, we give our intervention. The moment you provide our interventions, the child will always improve. It will not cure, because the disabilities do not cure, but they can improve.
I feel your passion, Mr. Mubarak.
Thank you. Then the other challenge is we don't have we don't have the educational psychologists in our system, our education system. We need these psychologists to do the assessment, like I mentioned earlier, clinical psychologists, educational psychologists, to do this assessment. We used to have a team of psychologists supporting us at the assessment center some 2-3 years ago, when we had a partner, CRANE, Children at Action Risk Network. We had a partner, so they used to support. But in the structures of government as of today, these people are not there. So even if we wanted to recruit them, we do not have the structures through which they could be recruited. Otherwise, it is important that we get them. The speech therapists, they would work so well. For example, in some of the special schools, we have these therapists there, and they're doing quite a good job. But they are being supported by some partners and maybe the school management committees. Then the referral pathways. For us in Kampala, we have always told our head teachers how to refer the children. If you identify a child in school that has issues, let us know. So they always call me. Then, basing on the explanation of the teacher, maybe this child has autism, I know where to refer. I say, okay, you refer that child to the assessment center, we shall assess. This child has epilepsy. Okay, that is now a hospital issue. Take the child to the hospital. By the way, special needs does not necessarily mean disabilities. These things are quite different. Every disability is a special need, but not every special need is a disability. We have special needs that are health conditions. Like I'm saying, epilepsy is a health condition and it is a special need. We have the sick class, those who have sickle cell disease. It is a special need. And these ones are also many in schools. And their biggest challenge is they normally have issues with they get so tired. They get tired so easily. They normally have joint pain. So when this child is writing, you write for 10, 15 minutes and he gets tired and he needs time to rest. So we recommend that child should be given extra time to accomplish her writing activities, which sometimes our schools do not do. But when it comes to UNEB, they do it very fast. Oh, this one has a special need.
These are very amazing facts, Mr. Mubarak. But looking at my clock here, time seems to be against us. And just around this time, allow me put a comma at that
Thank you.
as we prepare to have you on again. Lady Rosemary, over to your side. From a practitioner's perspective,
Yes.
what barriers do families face in accessing timely and appropriate assessment services for their children? But also, you will speak to us about what role can community-based organizations play in closing the identification and assessment gap. Over to you, Ms. Namboze.
First of all, thank you so much, Jackie and UCRN, for giving me the opportunity to a little bit share about issues of assessment and accessibility for accessibility services for children with special needs. This is my take. when we talk about assessment, we are looking at the systematic changes or the systematic, I would call them intersecting issues that confront the sector of disability. But for me, my presentation today, I'm going to focus mainly on what assessments mean to a life of a caregiver. Whereas we are talking about inclusive education and we are looking at the child. Inclusive education without knowledge of a caregiver becomes a very challenging sector. And some of the biggest challenges in terms of accessing assessment services for these children, the biggest challenge lies within the caregiver's decision in terms of, taking your child for assessment and understanding your pathway into the education of the child. 14 years ago, I walked through an assessment of my son. And the report came out, my son had Down syndrome. And yes, the doctors put it forward very well that he will never do blah, blah, blah. He won't be able to do this. He won't be able to do this and that and that. I want to tell you, after the assessment, I and my husband, we sat in a car. We held a quiet moment. We chose not to speak not because we didn't have the words, but the power of assessment and diagnosis was not well articulated to support us, even engage our child, to the next level. What am I trying to say? There's a power on how you put the information on paper, but also how you share it to the caregiver. In most cases, one of the biggest barriers is the language, the medical language that is used to give to the caregivers, that in most cases, we withdraw, we freeze, and it takes us years again to go back to the referral pathway to seek a solution. So what I'm trying to say that the biggest barriers of assessment comes into our professionals that deliver the diagnosis, and they do not give us alternatives, options, and pathways. Apart from telling me you'll go here and there, that is not enough. You need to support the caregiver to fully understand, even if you talk about Down syndrome. I remember asking the doctor, what is Down syndrome? Because I had never heard about it. Doctors in most cases assume parents are aware of autism. Some parents, just one word brings them down. They pull out from the system because of the jargons and because you have not held their feelings right. So for me, the biggest barrier, another thing I would talk about, the biggest barrier is the scarcity of specialized personnel. It's very true that Uganda will lack qualified people, even in terms of doing assessments and diagnosis. We have had cases of children with dual diagnosis, but because of the lack of expertise, we addressed one issue. For the last 13 years, I was told my son had Down syndrome, and we're handling that. They missed out on the diagnosis of the fact that he has ADHD. And I kept on struggling with the same. Maybe even me as a parent, I failed to understand why my son cannot settle, cannot focus, cannot learn. And I was within the inclusive education system. Until one of the parents supported me and told me, Rose, I'm seeing something different. Whereas I was seeing it, but I was hesitant to confront that big elephant of ADHD. And so the scarcity of specialized personnel will leave many cases of children undiagnosed, and then it becomes difficult to learn. It becomes difficult for our children to live within the mainstream system supported, because in most cases, the diagnosis hasn't been well articulated. The cost of transport, the cost of keeping up with the assessments. Sometimes to get a specialist to look at a specific area, you have to travel distance, you have to, you look into the economic costs. Assessments are very expensive. The referral pathways, as Mr. Edie talked about it, the referral pathways have waiting lists. Parents wait for months and months before you are supported, especially when you seek government services. And that becomes one of the biggest barriers. And the quality and appropriate, assessment, the appropriateness of the service. Sometimes, for example, if you have a speech and language therapist and your child has hearing challenges, in most cases, we are told that when speech can help to do this, but in most cases, the appropriate assessor for hearing challenges may be different from a speech therapist. So still, this goes back to the technicalities of supporting our learners. I want to quickly go through the next question. I hope I've answered the barriers very well to assessment. The next question, before I go to the next question, I want to put a disclaimer here, but I really think this will support the policymakers or the practitioners or ourselves into this, that the greatest stakeholder in inclusive education is a caregiver. It all starts with a caregiver. If a caregiver has not come to terms with the reality that the child has a special need, the more years he takes in denial, the more years a child will take not to be enrolled in a school. So for whatever interventions we are doing towards supporting inclusive education, let's put a lot of emphasis on a caregiver. A caregiver will make the rightful decisions concerning their children because they know their children better. But caregivers come to schools and claim, my child can do this, my child can do that, and yet really she knows the struggles she has with the child. We live so much in denial. So unless a caregiver is prepared, and of course there is no amount of words you can prepare a caregiver, of course, after he has, he has gotten to know that the child has a disability, but you keep on pushing the right words. That you see, we are seeing this with your child, and this is what we think. Give her an opportunity to continue to understand the child. And then for inclusive education, we as caregivers, we drill a lot on Mr. Gogo, which I would discourage. In most cases, Mr. Gogo gives us information that leaves us in pieces. We cannot explain it to anyone. And we used to ask Mr. Gogo, what does it take for a person with Down syndrome to succeed in classroom setup for let's say, for UNEB exams? And Mr. Gogo will tell you, no, we have seen this over a period of time. People with the Down syndrome have intellectual disabilities. They can only have practical skills to take on, but mentally, academically, they can't do this and that. And then you close Mr. Gogo and you go into personal denial, pain, and by the time the school calls you to share with you what how your child is progressing, you've been already indoctrinated with what Mr. Gogo has told you. So I would like to discourage many parents, especially after assessment and diagnosis. Try not to ask Mr. Gogo a lot, but seek face-to-face intervention. Thank you. The next question you gave me talks about what role can community-based organization play in closing the gap? Working for community-based organizations or NGOs or actors, I think our biggest role should be in service delivery. Yeah, because that's one of the key mandates why we exist. We should put a lot of emphasis in ensuring that, inclusion within the communities is addressed, or we can pick up on a policy issue, to advocate as organization, and it can be a form of advocacy. For example, one of the key advocacy issues under inclusive education was mainly looking at attitudes of teachers, and plays, games were acted as the challenge of teachers may not necessarily be lack of skills. The challenge is attitude. We had an incident where one teacher who was working for a government school dared and swore that he will never teach. The child had delayed development and intellectual disability. And to that teacher, the attitude was that this child has a curse, she can never teach this child. But good enough, this teacher was in a government school, and we had a commissioner under special needs education, Madam Sarah, who did a very great job and said, if you can't teach this child, then you don't have the job. So what does that mean? That even if such a teacher is given an opportunity to be trained, the attitude tells her she can, it's impossible to train such a child. Okay, there was echo feedback and what. So one of the key roles we can do as civil society organization, we have to do empowerment, ensure that also communities are engaged into the needs and the rights of children with special needs. And I would also like to say that much as some teachers also lack the skills, it's also very important as civil society organizations to organize, it's about budget priorities. Where do we want to put our energy and how do we do it? So it's very possible to have like form of quarterly capacity building for staff members, ensure that up to date, we give them the rightful information, and also we let them know that because right now inclusive education is the global thing, it's the trending thing. And I know most parents right now, especially when children are teenagers, most of them are under inclusion in inclusive schools. So the idea is the more we put this on the advocacy, on the policy agenda, the more acceptance will be addressed. So thank you so much.
Thank you. Thank you so much, Lady Rosemary. Hands of applause to you. I can see there. Please send in that emoji and let us clap Rosemary for that amazing sharing, for being vulnerable and telling us all about yourself, for being selfless. Thank you. That information cannot leave us the same. Hearing from the horse's own mouth adds a taste of authenticity to our discussion tonight. And yes, talking about teachers and inclusion. As teachers, if you are a teacher and you are listening in, how do you do differentiation within your class? Before you even think of assessing, are you already teaching using differentiation methods within your class? Come to think about it. But then I remember Mr. Mubarak made mention of we should, schools should not deny access to school for children with learning disabilities. What if the school is not well equipped? What if the school wants to impose or is trying to impose demands that are exorbitantly out of range, and I cannot afford that? But like many have said, there is a knowledge gap, and important, we need to bridge that gap. So over to you, Mr. Mubarak, once again. Hopefully, Mr. Eden Mubarak is there.
Yes,
Kindly
I'm
tap
there.
on your video. Yes.
Thank
Back to
you.
you.
Thank you once
Back
again.
to you. Back to you, Mr. Mubarak.
Yes, thank you once again.
Allow me pause this one question, and as you wind up, you'll be giving your parting shots because we need to get into the question and answer as well, because I'm sure our listeners have very, very, very many questions to ask. What policy reforms or investments would you prioritize to make assessment systems more inclusive and functional?
Yes, thank you
That
so much.
that fits into policies, education policies, and their implementation
Mm.
at the city or school level. Thank you.
Thank you so much. I didn't share my experience, but I also have some bit of experience. My fourth born had was born with Down syndrome at Chibli Hospital. She was a girl, very beautiful. I remember in the presentation I mentioned the name Mariam, and her name was Mariam. She was born on Christmas Day. So being Eden Barak, I didn't call her Mary. I called her Mariam Birunji. And Birunji is because she was very beautiful. She was born with the Down syndrome, and the doctor said, I think I need to check her. Please bring her every after 2 weeks. When I saw her, I realized, but I never told the mother. I wanted her to get these words, this message from the doctor, so that it doesn't come as a shock. Even the doctor had realized, but she couldn't say it there and then. So when she came after I think 4 months, they told her, your child has a problem. She has Down syndrome. So she came back and told me, they said, Mariam has Down syndrome. I said, yes. I had realized it. You know, with Down syndrome, you will see the child by appearance. It's common. I had realized it, but I think she will survive. We need to support her. Just make sure we engage her in everything. We do a lot of play, we do massaging and all that. I talked to my friend in the US, Dr. Vicky, and she asked me, doesn't does doesn't she have issues with the heart? They normally have holes in the heart. I said you haven't realized it. But when we went to the hospital, we asked the doctor. The doctor said, not yet. I haven't seen it, realized it yet. After like 2 months, she realized it. She said, she must be having issues with the heart. Go to Mulago Heart Institute. We went to Mulago Heart Institute. They examined her, and the doctor told us she has 2 big holes in the heart, and this requires an emergency surgery. I was like, how much? The doctor said, around 45 million. I said, can I get a breakdown of this money and where we are, and who is going, and where or which hospital is going to operate her? He said, you'll be going to India. I said, okay. Can you give us a referral to the US? I didn't have the money, of course, but I knew US has better facilities, and possibly if I had the breakdown, I would look for this money here and there. And unfortunately, okay, they said no, the child has to go to India because we already send their students for training. So we have that partnership. You take the child to India. I asked for the breakdown of the money. The guy told me, oh, you bring 50,000, and the issues I'm talking about are for quite long. That's 2020, I think 2011, 2012 there. You bring 50,000, we send a report, a file. We gave him the money, and he sent a file which was a message and an email. But we waited and waited for the feedback. We never received the feedback until when the child passed on. So that is my background in that area. Then denial. My sister has talked about denial. The truth is, some parents deny that their children have special needs, their children have disabilities, but you don't have to deny. The earlier you accept, the better. The earlier you receive the interventions, and so the child will always improve much better. Recently, I did assess a child, and when the teacher brought a child for assessment, and when he came to pick the report, he said the father is bitter. I was like, what's the problem? I told him, we have assessed this child, and now she's likely to receive support during UNEP. The father is bitter. He's saying you'd not support. You would have told me this early enough. Now it is very late. You are telling me you are doing assessment. The child is going to be supported at this time now. I wish I knew early enough. So we need to do this early intervention, early assessment, early identification, and then early intervention is. And I told the teacher, the father is very right. If this child was supported early enough, she would be fine. Even gaining self-confidence. Teachers' attitudes is still a big challenge. And yesterday I was training some people, and I told them, when you talk about special needs, we think these issues are very far away from you. Just imagine tomorrow, if that child of yours, your firstborn, if she got a special need tomorrow, just imagine any special need that you have ever come across. What will you do? We need to adapt. So teachers have got to adapt. These are legal issues. There's nothing you can do. I mean, if you still want to serve this nation, you have to accept that everyone has a right. Education is a right, a fundamental human right. And you have to do all it takes to ensure inclusion of these children with special needs. Simple. You don't have to deny anybody the right to education. And the teacher swears that he will never teach a child with a special need. How I wish this teacher, how I wish God gave him a child with a special need, and even a profound special need, so that he understands what it takes. God forbid. I don't think that prayer is good, but sometimes you feel we are not being fair to ourselves. Just accept and support these children. There is nothing. This child has never applied to God to acquire such a disability. There's no application form people fill to get disabilities. Now, you asked about a question that what if the school doesn't have the facilities? The Education Act is very clear. It tells us that before we register a school, we should make sure the school has facilities that cater for all learners, including learners with special needs. That means if you tell me your school does not have the facilities to cater for special needs, then you don't deserve to exist. Why don't you close the school? Because it is a policy issue. The moment you don't have facilities for special needs, then you better close, because you lack the basic requirements and minimum standards. So every school should have or provide or improvise facilities for learners with special needs. Yes, many of our old schools do not have accessibility, do lack accessibility. But the moment you get a learner, for example, a learner in a wheelchair, make sure you provide accessibility. Simple. The Education Act 2020, that's CAP 115, is very clear. It says, no education institution is allowed to deny a learner an admission on the basis of a disability. That means when I bring my child, my daughter, Mariam, to your school, whatever disability Mariam has, this daughter should be allowed for as long as she qualifies to join that school. If it is nursery, the qualification is basically age, then this child should be allowed to, should be admitted. The same act tells us that after you have admitted this child, you are given 3 months to put everything in place to ensure that the school is inclusive. Put all measures in place to ensure inclusion of Mariam in your school. So you look at her needs and make sure you provide whatever she requires. And it is the school, the institution to adjust, not the child, because this child, this is my nature. I mean, if I have a physical disability, then I have it. So this child, the school must, and the issue is a must, cater for the needs of the learner. And this is the very reason why we leave our homes every morning to go to our places of work to ensure that we support these children. So that one, I'm of course talking about the policies, like you asked about the policies. The policy is very clear. The Education Act, CAP 115, is very clear on Section 6, and it is very elaborate. In fact, some of us may think, even if we do not have any other policy, that one is good enough. But also the Constitution of the Republic of Uganda, Article 30, it says education is a human right. Everyone has a right. It is a right to all, and all means all, without discrimination. This is why even adult education is has been promoted. So we should provide education to all as a matter of a human rights issue. Then you have Article 24 of the UN CRPD, the United Nations Convention on the Rights of Persons with Disabilities. It is very thorough on issues of inclusive education, very thorough. Let us use these legal issues and we support. And the issues basically about understanding, accepting attitudinal issues, changing our attitudes. There are some cases we are handling. There is a case we are handling of a parent who actually admitted a student with a disability, a school that admitted a student with a disability. And now afterwards, the head teacher went to the school and said, no, this child we cannot accept. You see, she's very bad, very too bad. She cannot manage. What is it that she cannot manage? He called the mother, please come and pick your child. The mother says, no, my child, yes, she cannot manage certain issues, but there are things she can do. Okay, can you leave her there for purposes of the social inclusion part of it? Because she will change some behaviors. She has already adapted a number of behaviors. She has learned to do a few other things. I know she will not become a doctor. She will not become a teacher. She will not become an engineer. She will not become a lawyer. But there are certain things she can do. Can we look at this other side of what she can do? So they called me. Mr. Mbaraka, there's this child, please take her away. Remove her from here, take her to another school. I said, was a formal assessment done? They said no. I said, okay, let us assess this child. I sent her to the clinical psychologist for assessment. But before the clinical psychologist produced the report, they were again calling, we want this child away out of school. The mother said, it's okay. When I brought her, she was admitted formally. Can you write to me if you don't want her in school? They also wrote a letter saying, this child, release of your daughter. Your daughter was admitted in this school with a special educational needs.
Wow.
However, our school does not have a special needs educational unit. Therefore, we cannot cater for her needs. In the best interest of this learner, we have released her today. Take her to another school that will support her.
Best enough.
So they brought that. They got that thing, and now the parent has gone to the law, and she's asking for a fair hearing. Because if you are saying my child, and the mother says, I even paid all the monies, and the child even cried, and even other children cried. And for them, they were saying, it's an emergency, just take her now. I was like, what do you mean by emergency? Is it between life and death? Is the child complaining? Is she destructive? Just imagine if this child was yours in your house. Will you treat her in the same way? You don't want her in your dormitories. Would you construct a special house for her so that she doesn't interact with the other children, with the other members of the family? So these issues we really need to handle. We need to support these children. Thank you.
Very, 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 very true. We are delighted to be tapping from your rich expertise, Mr. Idim Barak, and I'm very sure that the listeners out there are very, very grateful. Even looking at the comments that are flowing in, you have done as well. So amazing. But allow me make mention that, well, as we reflect on advancing inclusive education, like you said, it is important for us to recognize that the government has made commendable efforts. Yes, we see policies, we see programs, we see commitments, all aimed at ensuring that every child has access to education. However, Mr. Mbarak, you'll agree with me that when we look at what is happening on ground, we still see gaps in implementation, resources, and awareness. Schools are allowed to operate without these facilities. Teachers are still in school making such curses that have embittered you to even make that statement of cursing that teacher. But thank God you withdrew it. So the conversations today are not just just for us to talk. It is very important that we begin to practice and explore all possible avenues of how best we as educators, parents, organizations, and communities can work together to make inclusive education a lived reality for every child. So as we see what the government has done, let us also see how best can we support. I know we have gaps in monitoring and evaluation for very many of the government programs, and even the people that are supposed to implement, to effect these things, sometimes are compromised with bribes. Schools will be allowed to open and operate even when they are infringing on the rights of the children. But then what do we do? Can we become whistleblowers out there in the community? Can we look out for people that are so passionate, like Mr. Eid Mubarak that works for the government, so that we use them very well to make sure that we advance this cause and have these schools practice what they have signed to, that they have taken an oath to. So allow me run to our comments in the and looking here, Madam Rosemary Namboze, I will push this to you. What is our plan for the children who are older and have been retained or denied access to education, not at the developmental level of his peers? They can't stay in nursery classes as an old and big student, but they can't stay in their age level classes either. How would you advise? And yet we want them in the mainstream school. Over to you, Madam Rose, briefly.
Thank you so much, Jackie. It's very clear when we are into issues of implementation of inclusive education, young age can easily be absorbed, but as they become teenagers, it becomes difficult. However, teachers are encouraged to identify the skills the children have. And in most cases, children with different special needs have extra abilities within them. So what normally is done in inclusive schools, if a child's interest is into music, they identify a music class for them and activities within music. And when they love practical things, when it's time also for sports, they engage them. So, and not necessarily teaching them what the typical classroom would be. I have seen this, my son goes to the International School of Uganda, and he's in grade 9. Grade 9 would be senior 3, senior 4, but definitely he may not fall through. But I loved the way they were teaching him science. To him, science is practical. They would bring clean water and dirty water, and they ask him, is this water good for you for drinking? And then he would also point that this is bad for my stomach and this is good for my stomach. Don't do this. It becomes more practical. And those are the reasonable accommodations schools are encouraged to do when it comes to teenagers advancing in education. Identifying early their skills, becoming more visual and more practical, and also working out on their sensory needs, because at that level, the behavior are hyperreactive, they are disruptive, but again, they have those spaces within them that they want to be alone, which sometimes it's necessary. You let them be, but also the easiest thing is always to find out what are the triggers to behavior challenges, and then how can we address the behavior challenges, and then create those spaces that are more practical for them. For example, farming, do you have rabbits around your school for practicality, vegetable gardens, trying to put up simple vocational skilling programs within the school. It can be even in a primary school, because some learners with disabilities past 13 years, or in an environment, agriculture is necessary. And I'm so glad the government of Uganda has also changed the curriculum to become more project based. So I would encourage schools to put up more practical projects to allow learners with special needs, but also not to structure them to fit exactly within the school program. If after lunch is exhausted, let him be, and let the other learners continue with their classes. We have challenges where schools are like, this time is for parade, this time is for this. Learners with special needs may not fit into those structures, but they can be good elsewhere. My son is now in the school band. He plays drums so well. When it comes to his pace,
Wow,
you
amazing.
see the energy on board. And yeah.
Amazing. I'm happy for your son, Rosemary. Those are very good milestones. Important to add to what you just said is that it is important for teachers, for the school system to incorporate a point where a teacher will sit with the caregiver and to set targets for that child, so that we manage the expectations of parents. Sometimes parents expect heaven on earth, and yet these things are not practical with the kind of learner they have brought to the school. So sitting to manage parents' expectations would support them to support the child better. We are able to show what indicators are we going to look at for what subject. Under this subject, what outcomes are we looking for? What is the impact at the end of it that we are looking for, so that you're able to measure those milestones together with the parent. At the end of the day, the parent is not going to hold you at ransom that my child has not achieved. And yet you sat and agreed that given the challenges this child has, given the abilities this child has, this is what we are going to focus on. Once we work in partnership, such a partnership, trust me, we are going to achieve milestones. Every person is born special. Every person has a purpose for which to fulfill. So we must be enablers of people's visions, enablers of people's purpose, for us to be able to deliver them there. So I see another. This sounds like a piece of advice. Before the teacher, the midwife should be deliberately targeted to identify those disabilities that can be identified at birth and during the early days of the child. Parents are aware early enough, then it can help support to prepare the child for education. Yes, please advise the parents within your reach to do prenatal care carefully, so that some of these things can be foreseen. Let it not stop at completion school, but helping these children with employment opportunities. Employment opportunities, how possible is that? I think this is sent to Eid Mubarak. Mr. Mubarak, kindly help us. Are there employment opportunities for such children as these?
Oh, thank you so much.
Hmm.
Yes, I know there are employment opportunities. For example, these days when they advertise, for example, in the government, they encourage persons with disabilities to apply if you have the qualifications. But also, the government has come up with some grants. We have the disability grant, we have the Myoga, we have the parish model. All these persons can benefit from all those grants, and the disability grant is actually very easy to access because they want a group of only 5 people. You register with the CDO, Community Development Officer, then the process, you are guided through the process, and people will receive some money. So government, I think, is very intentional on such things. But also I wanted to give some guidance. I'm looking at the time. Guidance to the parents.
Yes, our time is fast spent. You're right.
Yes, guidance to the parents. The parent is the first teacher of her child. I want to request parents, dear mamas and papas, support and train your child with a special needs better than any other, because the other children can even learn on their own. Activities of daily living, a child should be able to do the activities of daily living, issues of dressing up, brushing her teeth, going to the toilet, cleaning up herself, bathing. Those are very important, because there is that time when you will not be around with the child. Yes, some of us say, yeah, we shall support the. I'm ready to support my child. Back last. Yes, you are ready to support. But God has a timetable for all of us. Imagine that
Mm,
time when you not be there.
mm,
It is very unfortunate that when we die, our relatives will easily take up the EDs who are okay, who do not have any
mm.
problem,
And abandon the others,
the
yes.
Jammers who have no challenges, and abandon this Eid Mubarak with a disability.
Hmm.
Especially if we cannot, if there are things that he cannot do the activities of daily living on his own. So
Hmm.
let us train this child. If the
Thank
child
you.
has been trained, then it is very easy for any other person to support.
Thank you
Thank you.
so much. And that I want to bring the plenary discussion to a close, but allow me make mention of what people are saying, and that will cover for our takeaways. I see people hinting on the Danida closure of the assessment centers. Mr. Eat, there's an outcry. Is it possible for us, for the government to push for reopening of these centers? One center cannot be enough. Yes, I see another one echoing the policies. Policies are there, thank you, government, but where are they functional? Can we support functionality of these policies, especially with the people implementing them and us that are policing? I know takeaways are quite many. People have had notebooks, but given our time, ladies and gentlemen, the Muganda says, "Nali mewalunzu, atera nanyuka." So allow me bring this to the end by inviting our thematic group chairperson, Mr. Adrama Joseph from Fawe, to give us closing remarks. Over to you, our beloved chairperson.
Yeah, thank you so much. It's been quite a nice discussion. Already introduced Joseph Adiama. I'm seated here at the Ginger Nile Resort. In Ginger, there is a conference organized by the MasterCard Foundation. So I've been here the last 2 days, so I had to step out of this meeting, out of the conference. You can hear some noise from the background, but
Oh,
it's
yes.
yeah, there's a big conference here organized by the MasterCard Foundation for partners that they fund across the country. Yeah, so I think for me it is a good learning to listen and first of all to appreciate our forum, our network for being able to organize and identify this thematic area. It's when listening to the experiences, and some of them it touches me as an organ as far away, because some of the things they really touch us as an institution, but also getting to learn and lessons if we have children with disabilities. How do we handle? In our village, in my home, in the village, we have a child with disabilities that we have failed to get a solution. Up now, the girl has grown, maybe nearly coming to 18 years, but we have, despite at home, we have people who are educated, they have money, but we failed to get a solution to this young lady. So she has remained there at home. So for me, it's a good thing for this discussion, and I really want to appreciate our network and the participants who have been able, and the key speakers who have been able to share. when listening to Mubarak, I was just trying to think about issues around time assessment. And maybe he might not be able to answer now around where can we be able to really get effective assessment. At FAO, under the Mastercard Foundation, we do scholarships, and we target about 5% of young people with disabilities for higher education. And last in cohort 1, that was 2024, we failed to get students. Last year we tried, because our scholarships are targeting science students. Last year we got quite a number of applicants, and most of them had the eye issues with the eyes. But of course, maybe some of these were motivated to apply because it was part of the requirement. So some of them we could see right away that maybe they did not have impairment, maybe they had some kind of symptoms. But I think our challenge was where to get quality assessment. As I can tell you right now, some of these students are into our program under the name of those with disabilities, but we don't have a clear assessment report on each of them. So I've been pushing my colleagues in education to ensure that we have assessment report for these students. We also, some of the students, we took them to Jinja here. I think one of them we took her to the Jinja School of Nursing, and then one of them to the lab school Jinja. But after a few days, we were called to come and take them away. We were called to go and take them away. We were given formal communication that please to come for your students, they do not qualify. They cannot manage these courses. So you can imagine, we had to go and pick the students. Of course, Mbale School of Hygiene came into our support. They said, yes, they can do the courses offered by the School of Hygiene. So they told us they cannot be nurses, they cannot be lab technicians. But maybe if we had done assessment early, wouldn't have created this kind of atmosphere to the students. We would have taken them directly to Mbale. Other than, because we created a lot of anxiety to them, stress to them to relocate from Jinja to Mbale. So that's just our experience as FAWE. And I really, one of the reasons I have endeavored to sit in this meeting is because it is informing me as FAWE on the scholarship program. We have just advertised for another 600 students. And we are going to go through this process. And this time we are going to be very strict on assessment, even before we give award letters to these students, because it is very important to see that assessments are done early in time so that you can be able to target the students to where they fit. The other experience I want to learn from Mubarak, if you have a school which has about 90 students and there's one child with disability, and the school has to provide for this student. In one of the areas I was told that they try to provide for this learner, and it almost became like a tourist attraction for the teacher delivering for this learner in class. And the school, I think, had to find a way of transferring this student to another school, which had many learners with disabilities. So how does the law deal with such situation? We also had challenges with our child mothers because we also support child mothers. We take a child mother to a class. Yes, the government allows, every process has been there, but just by the mother stepping in class, the learners are not studying. Everybody is like an attraction because of this situation. Of course, we do counseling and supporting her. Good enough in one school, the girl was quite strong-hearted. She managed to study even with the kind of amusement from other students. But some were not able to study, disappeared. They dropped out. So for me, it is an experience to learn, but also a number of things that I take note here as FAWE, but also commending you, the network, for being able to identify this topic. And I want to thank everybody who has been here. It is nearly 2 hours and we have all endured. I want to believe that we shall have a report. We have lead points that we can listen in from Nabose. I want to believe that my team will be able to have further engagements with you, especially also the technical person from City Council, especially around time assessment or how we can support.
Thank you. Thank you very much, Joseph, for those wonderful closing remarks. I'll give chance and opportunity to the chairperson, the
So,
children
so,
with
so,
this.
so, so for me, just as I conclude, again, to appreciate us for enduring to sit here for 2 hours and listening to these comments. I know the secretariat will give us a report, and then also give the contacts of the persons that we can be able to follow up to ensure that we get some of the items that we have not been able to conclude here. Others, on behalf of FAWE, on behalf of the secretariat, on behalf of the organizers of this activity, I want to say thank you so much, and I wish all of us a good day. Thank you.
Thank you so much, Joseph, the chairperson, education thematic group, for those wonderful closing remarks. I'll give chance to Rosemary, the chairperson of the Children with Disabilities thematic group, to also share her closing remarks.
Thank you so much, John, for the opportunity. Definitely, I'm so happy to see that we are rolling as the Children with Disability thematic group. This is a pull through for our thematic area. As always, we've had issues like we are unable to hold enough activities to engage our members, to engage the policymakers. I'm so glad that UCRN is bringing this in a strong way and deeper. So thank you so much, the moderators of this webinar. I'm so glad to know that Idi Mbaraka's experience as a caregiver, and this spoke to us. Long queues for assessments pose big problems. It's so heartbreaking for a parent to end the journey just because he has failed to get the services on time. So I think next time we should have discussions on long queues, delay in assessment and diagnosis, fragmentations. You know, you keep on giving a parent fragmented diagnosis. Today they are saying, yes, he has Down syndrome. Then before he comes to terms with Down syndrome, you're saying the child has ADHD. You know, the whole process is heavy on both the caregivers, the school system, the government, you know, the budgets that are needed to ensure that inclusion takes its upper seat within this country. But we have to keep on pushing, and lived experiences to continue share their experiences, because it's through this journey that we are able to change a lot and work towards ensuring that our children are in the safe environment, and as a country, Uganda, we spearhead this. So thank you so much.
Thank you very much, Rose. Since we have been talking about inclusive education, I'll give chance to Sarah Kisitu to share something around the World Autism Awareness Day. That will be on this week on Thursday. Sarah, are you there? Sarah, are you there? Sarah Chisitu? I see Sarah, you're on. Yes, Rose?
Yeah, on Thursday, 2nd April, it's World Autism Day, and all organizations in the disability fraternity are joining hands, coming together on creating more awareness about autism and the abilities people with autism can bring on board. So we are calling upon policymakers, caregivers, organizations to all join hands to get to Katikati grounds on Lugogo bypass to be part of the major events. Such days are the only opportunity we have to advocate for our children, their needs, and many others. I really thought Sarah would be around.
She's on.
But nevertheless, Yeah, she's on, but maybe, yeah. But anyway, for 2nd April is the International Day for People with Autism. Thank you.
Thank you very much. We do appreciate all the members who have been on the call, but special thanks goes to our panelists, Idi Barak Simani, the Inclusive Education Officer at KCCA, and Rosemary Namboze, the Executive Director, Angels Center for Children with Special Needs, but also our lovely moderator, Jacqueline Babazi. Thank you very much for moderating this webinar. We thank you very much, members, also for sparing time and joining in this wonderful conversation that we have held. And we shall be sharing with you a report, like the chairpersons mentioned. Thank you very much.
Yeah.
Recording stop.